Hello, let's discuss an interesting case today where a characteristic diffusion restriction pattern helped us clinching the diagnosis of this case. In this case, you can see that there is diffusion restriction along the corticospinal tract, perirolandic white matter, then in the posterior limbs of internal capsule, midbrain, pons, then dentate nucleus, cerebellar white matter. All these areas are affected. Subsequently, if you see the ADC, you can see the frank diffusion restriction. So this is classical intramyelinic edema. Only myelinated areas are showing diffusion restriction. All these classical pattern you are able to see. So this characteristic pattern you see in a case of maple syrup urine disease. In T2, the areas involved are hyperintense. So this is a classical case of maple syrup urine disease, which occurs mainly because of defect or mutation in the branched chain alpha keto acid dehydrogenase complex activity, leading to accumulation of branched chain amino acids like leucine, isoleucine, valine, and their corresponding K2 acids in the plasma and urine. So main MRI findings are diffusion restriction, which is the most sensitive sequence where you can definitely diagnose in acute phase. And involved areas, all the areas were involved in our case, like posterior limb of internal capsule, globus pallidi, thalami, brainstem, deep cerebellar white matter, cerebral peduncles, corticospinal tract, peridolantic cerebral white matter, coronary data. Except for the optic tracts, almost all areas were involved. And T2, they were showing high signal intensity areas. It occurs only in myelinated areas. So this is intramyelinic edema. And in our case, the areas which were not affected with vasogenic edema were not seen. And spectroscopy, another case I had where there was elevation at 0.9 to 1 ppm, you will get this isoleucine, leucine, valine peak. We have not performed spectroscopy in this case. And this is a classic form, we believe. It's very common. 60% of the cases will have such a presentation. With more lesser forms is the intermittent form, where there will be 30% case double mutation, where there will be associated DBT mutation will be seen. The least commoner one is a thiamine responsive form. Differentials, non-ketotic hyperglycemia. In our case, we considered hypoglycemic encephalopathy. Ultimately, the treatment is like restriction of this leucine diet. We have to give branched chain amino acid free supplements so that they recover faster. The diet is most important part. And some people respond with thiamine responsive MSAD, which is a relatively rarer form. In some cases land up in liver transplantation. If you continue to give this same diet without having an accurate early diagnosis, patient will land up in death. So diagnosis as a radiologist is very important. Prognosis nowadays with proper treatment, neurological deterioration can be limited in less than 85 to 90% of the cases. There will be improvement. So that way, the diagnosis is very important and right time. Thank you very much. Hope this case on MSUD was useful for you.